Hello, everybody. Welcome to Post-Incident and Light Duty. This webinar, we'll jump right into it here and start with the presentation. My name is Seth Thompson. I'm a safety and risk advisor over here at LeBaron Carroll Insurance. For those of you who don't know me, I'll jump right into it and we'll get started. If you have any questions, you can do them in the chat, and my coworker Colleen will help answer any questions that you might have as well. So I'm going to go ahead and share the screen here. Okay, so when we do have accidents or injuries, it's important to know what the process is, and it's very important that our employees also know that process as well. So we'll be going through that process, how to handle those injuries. And then a very important part of this is what do we do once that person has been treated to get them back to work? This is the most critical thing that employers can do to control their EMOD rate. Uh, I'll get into that in a little bit and explain what EMOD is. But having something for this person to do where they can't do their normal job because of some type of work restriction. So we're going to talk about the importance of your role as the administrator of this program or as the person who implements it or does the investigation, what the business rationale for early return to work and a supportive attitude, what you can do before, during, and after an injury or illness. We'll do a little bit of problem solving and then we'll review to wrap it up. Your experience with injury management, the experience that you've had is an important tool. You've seen the different things that the ways things can go wrong. Knowing some of that is going to give you a lot better advantage in knowing what to expect down the road. So some things to think of is how many of you have dealt with an employee who came to you with a work-related health issue? If you've never dealt with this before, chances are you will at some point. How many of you have dealt with an employee who went on leave, right? Somebody that had to leave for either medical reasons or resulting from an injury or incident at work where maybe the doctor told them that they couldn't work. What kinds of injuries and illnesses do you see at your company? So if you're not sure what kinds of injuries your company normally experiences, one of the things you can do is talk to your agent about getting your loss runs. These are all the reported work comp injuries that went into that were reported to work comp. So they'll have a list of all those things as well. Sorry about that. And then can anyone, obviously you guys can't share, but think about, have you ever helped an employee come back to work after a disability? And one of the things that can help that person is transitional work and what kind of modifications you have to make to their duties. So this is going to require some creativity sometimes. If somebody has a normal job that's very physical and they have severe work restrictions, like maybe they injured their back and now they can't sit for long periods of time, or they can't lift heavy things, or they can't do a lot of physical activity, you want to come up with some kind of job where they're contributing to the company that they can do within that restricted capacity until they're cleared for duty by their doctor. I've had some companies, they're like, hey, we just don't have a lot of work for them to do, so they'll have them go do volunteer work, and they'll pay them to do volunteer work. So there's lots of options out there. You just have to get kind of creative sometimes. Okay, so you want to make sure that you have a good communication with your doctor, right? Or the nurse, whoever is treating your patient. You want to, whenever possible, call them ahead of time, let them know your employee is coming. This is why I always suggest that businesses have a good relationship with an industrial medicine clinic. Don't just send them to the nearest place. Don't just send them to the nearest Concentra or urgent care or whatever it is because it's convenient. If you can develop a rapport with a specific company, you're going to have a much better relationship. They'll be better at taking care of your employees, knowing what your needs are, and also giving you guidance on how to get that person back to work as quickly as possible and giving you the information that you're needing that sometimes the insurance carrier works. The supervisor of the individual needs to be involved in this process. The supervisor is responsible for the safety of the people that are working underneath them. So the supervisor is the ideal person to be doing the accident or injury report, documenting it right when it happens, and getting all that information to human resources. Your claims adjuster, you also have to let the claims adjuster for your carrier know when somebody gets injured at work. That way, you report it right away. There's no questioning the validity of the claim or when the claim happened. That happens with really late reporting. Human resources needs to be involved because this involves medical information. It's privileged information, HIPAA laws, things like that are involved as well. And then you need to make sure the employee is involved. You need to stay in contact with them. You need to make sure that they know what the plan is for them, that they have a light duty return to work program, that you will have work for them to do, that you guys will accommodate any types of medical restrictions that they have. So, what can cause lost time or restricted time to go longer than normal, right? So, one of the things is if somebody feels like the supervisor or the company responds negatively to them getting hurt, right? Nobody goes to work thinking, hey, I'm going to get hurt today. That's my plan. Nobody's choosing to get hurt at work. But when the supervisor comes down on them and tries to blame them like it's their fault, or they get upset because it's going to take away from the productivity of the company, that individual has a very negative experience about it. And they feel like they're just another object at the company. They're not a person. They're not being looked after or looked out for. If they don't hear from you guys at all, right? If they're off, if they can't work and they're on medical leave and they don't hear from you, then they feel like they've been forgotten about, that they've been left behind, and they start to develop resentment feelings and things like that. If the company doesn't really show any interest in getting them back to work, a return to work program, that's the whole point, is to keep this person involved, keep them working, and get them back to work as soon as possible. And then the other thing is being inflexible towards accommodation. Well, you're a concrete guy, and I don't have any concrete work with your restrictions, so I don't have any work for you. So you have to be accommodating for those injuries. There's something that person can do, whether it's making phone calls or helping organize files, scanning things in. All of those things are important. Uh, some non-injury sources of conflict that can prolong lost time as well. These would be things like poor performance, organizational issues, negative work relationships, disciplinary or pay issues, workload concerns, job dissatisfaction. So you have to be aware of any issues that this person was having prior to them being injured as well, right? Sometimes, and you shouldn't always think this, but sometimes people want to take advantage of being hurt and they want to really draw this process out as long as possible because they're not really happy at work. They're not really satisfied with what's going on or how they're being treated. So they're just looking to draw this process out as much as possible. And that's another reason why we need to stay in contact with them, make sure they know about light duty and return to work, and get them that offer letter as soon as possible, as soon as we know what their work restrictions are. And then some people will have psychological barriers. Some people may have been hurt and it is traumatizing to them. They may have some type of post-traumatic stress. They maybe come back to work and be afraid of getting hurt again or have anxiety about getting hurt. And that's going to be a distraction for them. Also, some people take it really personally, like they lose a sense of self-worth once they've been injured. They feel like, oh, I'm not as useful anymore, or I can't contribute. I'm not part of the team. They all forgot about me. Nobody cares about me, right? So issues with self-esteem. Also, they're maybe dealing with some financial issues now, right? Maybe they're having to spend money on medical bills. Maybe because they're not being able to work, and now the insurance is only paying them 66% of their paycheck. they don't get their full paycheck. The insurance carrier does not have to pay them their full wages. Whereas with light duty, that's another one of the incentives is you want them back with their full pay. So another reason why the employee should participate in that problem. And then it can cause family problems. This person that's normally at home or that's normally at work, now they're at home all the time. That can cause conflict at home. Maybe the spouse is wondering, when are you going to get back to work? That can cause problems as well. And then maybe they're worried about losing their position or their status at work. Maybe they were a lead or a supervisor or some type of a manager, and now they're worried that because they're not in that role anymore, maybe they're going to get passed over for a promotion, or maybe somebody else is going to have to be moved up into their place. So there's a lot of things that these folks are dealing with when they're hurt and they're injured before they come back. So let's take a look at lost time in a realistic way. Sometimes it is necessary, right? If you have a serious injury where this person, maybe broke their pelvis, or they are injured so badly that they're going to need time in a hospital to recover, or if they're going to need multiple surgeries or things like that, then we can't get them back to light duty as soon as we would like to, and they do have to stay off of work. Maybe their job is just to rest and heal up so that they can come back to work. If they have a serious medical issue during the recovery, maybe they get a really bad infection, right? And now they have to be at home because now they're getting regular antibiotics or something like that. The other thing is maybe they broke a rule and that's why they got hurt. This was the sixth time that you've reminded them about wearing PPE and they didn't wear PPE. So maybe now they're being disciplined and they're being sent home without pay. Or there's some kind of performance issue. So there could be all kinds of things that could make lost time a necessity, that we have to have it. Your job as the administrator or as the support staff is to find solutions to those challenges, right? Your job is to be a problem solver. You have to be the go-between. You got to be the person that reaches out, that follows up, that calls the doctor, that calls the insurance carrier, that calls the employee, that calls the supervisor. Your job is to solve those problems, respond to requests, go out and seek information, and then make sure that everybody is communicating and getting that information that they need. You have to act as the administrator of that information. And then accommodation, right? If somebody can't do their normal job, we have to find something for them to do so they can get their normal wages. They're involved with a company. They don't feel like they've been left behind. They tend to respond back better, and they also tend to return to work faster as well. So our job is to be accommodating to any fears that they may have, any doubts they may have. Um, and then we need to make sure that they're going to be comfortable in that role for as long as it is. Okay, so here's a little tree of the work roles and responsibilities. So right at the top here, we see this is when an injury occurs. Okay, so or an illness. So an injury or illness occurs. It's work related, so we know it's going to be covered, right? So we'll start over here on the left. Under the employee's actions, the first thing that the employee needs to do, and this is critical, is they have to tell their supervisor as soon as they get hurt. And this means that, oh, I kind of pulled my back at 3:30 on a Friday. It doesn't mean continue to work and see if it gets better because I'm looking forward to the weekend. You need to tell them right away. Because what you don't want is you don't want to have that employee wake up Saturday morning and their back seized up, and now they call it in, and now you're wondering, okay, was it work related? Because you didn't tell me when it was at work. Okay, so it's very important that they tell somebody right away. Even little things like splinters, they can get infected and turn into something really big if it's not properly cleaned out and taken care of. The next thing the employee needs to do is they need to follow the prescribed medical treatment plan of their doctor. They need to go to physical therapy. They need to take their medicine. They need to show up for visits. They need to show up for follow-up visits. Okay, that is what the employee needs to do. They also need to comply with work restrictions. You'll get some people that are like, I'm fine. I'll just go back to my normal job. Well, if the doctor says you can't do these things, then we cannot allow you to do these things. And not until the doctor clears you back can you do your normal job. So they need to make sure that they're following the restrictions inside and outside of work. So that means that if they can't be doing these, heavy lifting at work, they can't be doing heavy lifting at home either because they're just going to injure themselves and draw out their recovery. And then they need to make sure they're communicating any changes in their abilities or restrictions with their supervisor. If they start to develop inflammation and they have to take a break, then they need to tell somebody so we can make those additional accommodations. Okay, right here in the middle, we have the employer or the supervisor's actions. So the main thing here is right in the dead center, conduct an accident investigation. We need to document what happened. We need to gather all the relevant information for everybody that's going to be asking for it, the doctor, the insurance carrier, HR. And we need to make sure that we get people's statements while their memories are fresh. Take pictures of it. Let's capture the scene. Let's gather all that information right when it happens so it's documented and we don't have to go tracking down people later to find out. Their job is also to refer the employee to the preferred medical provider immediately or make an appointment. So their job is to tell them, hey, this is where I want you to go. They're going to take care of you and make sure that they go there. Don't just allow them to travel to an ER or wherever they want to go. They should go to your preferred medical provider. Then the supervisor needs to report the injury or illness to the necessary parties as soon as possible. They may need to notify their supervisor. They may need to notify HR. So they want to make sure that they're letting everybody know that needs to know it. The supervisors also need to accommodate the work restrictions and reemphasize the importance of return to work. So right when they get injured, you want to let them know, hey, we're going to take care of you. We're going to have work for you to do no matter what happens with your work restrictions. We also need to make accommodations to make sure that we make that happen. We also want to actively manage the claim disposition. So we want to be active in our role in talking to the doctor, gathering information, talking to the claims manager, talking to the employee. We want to be active in all this. We want to be proactive instead of reactive. The employer or the supervisor also needs to actively facilitate communication between the physician, the insurance, the company, and the employee. So we need to be involved in this process, stay on top of this process, and get updates as quickly as possible so we can move this through and get them back to work as soon as we possibly can. Along the way, we have to monitor their disability status until full duty return to work. So what that means is we have to make sure that they're not doing those things that the doctor says they can't do. So if we catch them lifting things they shouldn't be lifting, standing longer than they should, we have to make sure that they're following the work restrictions. We have to coordinate medical and disability information. So we may have to let their new supervisor know what their restrictions are, how often they should be doing physical therapy, how often they should be taking their medicine, just so we're helping manage that as well. And then complete and file all necessary return to work program documents. So you should have a return to work program. And if you need those documents, you can always reach out to us. You can reach out to Colleen, safety@lebaronandcarroll.com, and we can get you guys a sample written return to work program template that will have all those documents that you need in there. And then with the medical provider, their job is to, number one, provide appropriate medical treatment. Number one thing is we got to take care of this person, make sure they're healthy, make sure they're taken care of. Then we want them to evaluate whether the employee can return to work. So we want to make sure that we're able to get that information from the medical provider and they can communicate us what their work restrictions may be. We don't have access to all of their medical information. That's private information. But as their employer, we do have the right to know what their work restrictions are so we can provide that opportunity for them. The doctor also wants to establish a target return to work date and specify the modified or full duty. So we want to know, okay, about how long should we expect for recovery based on, what their diagnosis is, if they need surgery, if they need physical therapy, and then help us with, okay, can they do their normal job, but they just can't do certain things, or do they have to do a totally different job? And then um, complete and return to work forms. So there are also some forms that the doctor can fill out that will help the employer decide what kind of role they can have in that light duty return to work program. And they can help facilitate early return to work by evaluating job duties and suggesting modified work. So the doctor can also have some suggestions of things that they can do. That would be a really big help as well. And then communicate treatment plan and the modified duty recommendations to the employer. So having that partnership with the medical provider is a crucial key here. It's going to make the whole process a lot smoother. The communication will be more open, and everybody will be a lot more satisfied with the results. Okay, so we just went through this. Remember, the employee's job is to report the injury right away, do what they're supposed to as far as treatment, comply with restrictions inside and outside of work, and if anything changes, to let somebody know. The employer, again, first thing, do that accident injury report, make sure they get medical care, and then report the injury or illness to everybody that needs to. You might have to report it to OSHA, right? Depending on the severity of the injury. You're going to have to report it to the ICA in Arizona, okay? Then we want to make sure that the individual knows the work restrictions, reemphasize return to work, manage the claim, act as an agent of communication, watch the individual and make sure they're following the work restrictions, and then coordinate their full return whenever possible. And then that doctor, you want to make sure that they're taking care of the patient, giving you the evaluation as far as their work restrictions. The more information they can give you, the better. And then also stay in communication with them on getting them back to full duty. Now, why should a business take the time and effort to invest in a light duty return to work program, right? Some businesses say, hey, isn't that what I have work comp for, right? Work comp pays for that. Work comp pays for their wages to stay home until they can come back to work and start earning money for me again, right? Being a productive member. Well, injured or ill employees are often away from work unnecessarily, right? What that means is if the person can be there contributing, that's a bonus for the company. So if they don't have to be away from work, there's no reason to have them away from work. We talked about some of the psychological reasons, some of the social reasons that we would want them back as well. Okay. The idea is that most injured or ill people are capable of doing some kind of productive work. There's something they can do to contribute to the company that we can accommodate them while they return back to full health. Really long disability leave hurts employees, right? Like I said, there's psychological damage that occurs. They deal with self-esteem issues. They deal with lower wages. They deal with feeling like they're left behind. It can cause social problems in the home. Okay. And the way the business responds can reduce the frequency and the duration of lost time. So we'll have less incidents and people will be off of work for less time if we have return to work. It's in your interest. So the other thing is there's a price. There is a price that businesses pay when we have people with lost time injuries. They're the most expensive type of injury because if somebody's hurt so bad that they can't do their normal job, that's a fairly severe injury. That means that the medical bills are going to be higher, the recovery bills are going to be higher, the workers' compensation costs are going to be higher. Okay. Lost time costs employers between 4 and 6% of their total payroll. That's a lot. Early return to work can reduce workers' comp costs by as much as 30 to 60%. Workers who return within 3 to 4 days are much less likely to file lost time claims. And then injured workers away from work 6 months only have a 50% chance of returning to work at all. So now you're dealing with loss of employees, turnover, right? Hiring a new person, training that new person, getting them up to speed, Now we've lost production time. We've had to pay other employees overtime to make up the difference. So having that person back it makes business sense. With the employee, they're at home. Maybe they'll enjoy the first couple of days, feels like a vacation or something, but after a while they're going to get restless, they're going to get bored, especially if this person is a worker, they're used to working. Okay, they're going to feel unproductive. They're going to feel like they're not doing anything, they're not contributing. And if there's no communication, they're going to feel isolated. They're going to feel like you guys forgot about them, that nobody cares about them. Why should I go back to work when nobody cares about me? Right? The other thing, the supervisor with lost time, now the supervisor has pressure to keep up with productivity with fewer workers. Okay, I lost a crew member. Now maybe I have to work more. Maybe now we all have to stay longer. Maybe I have to go out and hire somebody, or we have to pay overtime, right? The company, higher benefits costs, right? You're going to pay out those bills. The insurance companies are going to recoup their losses. And because we've lost somebody, now I have lower productivity. I can't work as efficiently as we were before when I had all my employees. Being prepared makes a big difference, right? For the employee, it means less time away from work, right? Maybe they're off only for a couple days. We get them back to work. They're involved. They're doing their therapy. They just come back to work quicker. And that means a better health outcome, right? The more active they are, the more quickly they recover, the more recovery they will be full to their body as well. With a supervisor, it's going to create better relationships with the employees. Their employees are going to feel like the supervisor cares about them, that they're looking out for them, that they're trying to help them out, right? And it creates a value for your company. When people feel like a company cares about them and that they have a value there, they tend to stick around. You will have less turnover. Your people will be more loyal, and they'll work harder for you as well. As far as the company, being prepared means fewer injury claims, right? If you have a good, strong safety program, if you have a light duty return to work program, you're going to have fewer claims. You're going to have reduced medical and disability costs. People will be back, so you have higher productivity, and people will feel better. There'll be improved morale because the employees feel like the company takes care of them. The company has their back. It's looking out for them. It wants to make sure that they're healthy and recovered. So, what can we do before an injury or illness, right? This is where that proactive approach takes place. We want to create a safe workplace to reduce employee injuries. Right? A safe workplace means we're proactively analyzing the job site for hazards. We're letting people know about the hazards, and then we're also letting employees know how to recognize and avoid those hazards as well. Creating a respectful and communicative work environment, right? Letting people know that, hey, if you get hurt, we have light duty. We have resources for you. We can help you. We care about you coming back. We care about you getting your normal pay. We're looking out for you. You want to communicate the company policies on safety, injuries, and accommodations. You want to make sure all your employees are aware of that light duty program, or they're just going to go to their doctor. The doctor says I can't work. I didn't come to work. I didn't know we had a light duty program. So it's on the employer to make sure that everybody at every level is aware of that light duty program. Okay. You want to develop job descriptions for the doctors. So that way, when you have somebody get hurt, you say, hey, this is so and so's job. This is what they do. This is how often they stand. This is how much weight they typically lift. They do lifting above their head, below their knees, those kind of things. So the doctor can say, okay, these are the tasks that they will or will not be able to do under their light duty program. You want to use problem-solving skills to be prepared for high-risk jobs and likely sources of injuries. This is where things like a pre-task plan, a job hazard analysis really come in handy because you can analyze jobs and identify the steps along the way, identify the hazards, and then identify the controls and what types of injuries we're specifically looking to avoid. And Before an injury or illness happens, you can plan for accommodation with job modifications or alternative tasks. So if you already have, okay, this is a modified job for this type of job, then you don't have to come up with that. You already know what that person's going to do. Or you just have some uh, random fill-in jobs that other people can do that help the company. It could be as simple as answering phones, doing customer service follow-up, helping with filing, helping with scanning documents, searching for SDS sheets on the internet. So there should be just some standard things that people can do that are very low impact, very low physical demand that will work within their work restrictions. Communication. Communication is huge within a company. You want to make sure that all of these high level programs and policies don't just stay at the upper management where everybody knows about them. You want to make sure everything trickles down to through all layers of the organization. So when you're respectful about communication, you're going to get earlier reporting of injuries. When people feel like they can report an injury and not suffer any negative consequences, they're more likely to tell you those things because they know what the process is and they know that you're looking out for them and you're going to try to help them. The respectful communication also encourages shorter time away from work, right? Not letting that person think they have to stay at home, letting them know, hey, we have a job for you. You're going to start on Monday. These are going to be your hours. Here's what you're going to be doing. Here's how it fits into your work restrictions. And here's what your pay is going to be, right? And then because of that, you're going to end up with fewer disability claims, right? Disability means that this person has a permanent disability or some type of temporary disability that has to be compensated, and those tend to get very expensive. You also want two-way communication. It's not just top down, but it has to be coming from both directions. So you want to know from employees what is going on? What are you feeling? What are you worried about? What can we do to help you? We also want to make sure that employees are letting us know if they have any questions. If they don't understand the process, we want to answer those questions, right? We want to make sure that we have an open door policy. We want to be approachable. That's going to encourage early reporting. So they do tell me right when they get injured. They do tell me where they're going. They do tell me how they're feeling, what doctor they saw. That's going to help this whole process run a lot smoother. And then we want to practice what's called active listening. Look the person in the eyes, listen to what they're saying, and don't just wait for your turn to talk. Take the time to actually listen to what they're saying. Look them in the eyes, nod when you are agreeing or to let them know that you're understanding what they're saying. When they're done talking, take a moment to reflect back on what they said and what they were feeling, right? They're trying to communicate things to you beyond just their words. Sometimes it's body language, okay? So take a moment once they're finished to really absorb what they've said before you decide how you're going to respond. Don't judge them, suspend your thoughts and judgments, right? Don't start trying to think of, oh, this is what they're going to say or this is how I'm going to respond. Just simply listen. Keep your mind free from distractions. Don't look at your phone. Don't be doing anything else. Pay them the respect that you would want if you were talking to somebody as well. And then pay attention. Listen to what they're saying. Then that's really going to let you know, okay, this is what they're saying. If there's some confusion, repeat it back to them. Say, hey, this is what I hear you saying. That way, if there's any miscommunication, they can clear it up right then and there. And then after they've done that, you want to respond appropriately. Show your concern and willingness to help. Sorry this happened to you, but we're going to take care of you. We have a plan. We're going to get you light duty job. We're going to get you back to work, okay? Validate to confirm the employee's feelings. Whether you think that they're correct or not, their feelings are valid. They're having those feelings for some reason. So you want to make sure that they know that you understand where they're coming from, why they're following those feelings. Then take action. Let them know what the next step is going to be. Don't just leave it open ended. Take action. Let them know what you're going to do to help them. Okay. And then follow up. Make sure you're in constant communication. You follow up with them. Hey, I talked to your doctor. This is what happened. You have your physical therapy appointment next week. Are you going? Okay. Do you need a ride? Things like that. Be understanding, be supportive, be caring, and show that you're concerned and be helpful. That's what your role is in this process. That is your role to help these employees through this time, right? Like I said, it can be psychologically jarring. It's physically challenging too. So you want to be as helpful and as supportive as possible to these individuals when they get injured. So when an injury happens, you want to make some quick decisions, right? You're going to decide, hey, is this like a 911 type emergency, or is this something that we can fix with first aid? That's why it's important to know if you have somebody on site that is first aid trained, right? There's also other options like telemedicine, right? Maybe you call into a nurse triage first. Maybe you call into a company that kind of walks you through how to treat it over the phone, or if you need treatment, they'll actually come out and treat you there on site. If you need an ambulance, call them right away, right? If it's truly an emergency, call 911, get that person to an emergency room as quickly as possible. If it's not, if it's more of just a first aid issue, you have a little bit of time, you can take the time to treat them and walk them through the process. Like I said, there are on-site nurses available where you could have that service come out to the job site. They could do a little bit more complicated things like sutures, little higher level first aid things. They can also do mobile drug testing. So if you need that, um, tell them who your preferred doctor is, right? Or if they're going to a hospital, know which hospital they're being transported to. And then many employers also have just a standard policy that if you are involved in an incident or an injury, or incident could just be damage to property and nobody got injured, they have mandatory drug and alcohol testing just to make sure it wasn't a factor that contributed to this incident or injury as well. So those are some of the immediate decisions that you need to make. Okay, how are we going to treat this person? Who's going to treat them? How are we going to get them treated? And what are we going to do to respond to this? You also want to make sure that the employee gets the attention they need. So you have to facilitate access to the resources, right? You're going to make the phone call to the medical center. Hey, this is my employee's name. They're coming down to see you. This is what happened. Let me know what their work restrictions are going to be so we can follow up. Okay. Accommodate the employee to site of medical care if possible. So, if possible, ride with them to the medical site, take them in. You can facilitate that process as well. You don't have to just send them on their own or have another employee take them. So now you have two employees that are missing from work. Take all that paperwork we talked about, take their job description, all the other forms, and explain the policies to that employee on the drive. Hey, this is the light duty program. This is what this is for. We're going to take care of you. That way, when you show up at the medical center, you have that job description for the doctor. They can let you know how their work restrictions can work into their new modified duty or different job. You also want to make sure you're communicating with management, right? Promptly follow the guidelines for reporting work-related illnesses and injuries. Again, you also have to make sure to know if this is a OSHA recordable injury, the carriers, right? The ICA. So make sure you complete and send the paperwork. And then the other idea is having what's called a near miss documentation program, right? A near miss is something like a close call where something almost happened. Somebody almost got hurt. We almost damaged something. Something almost tipped over. By documenting those, we use that information to gain knowledge to prevent reoccurrence. So by reporting near misses, that will cause hazard reduction in the job site as a whole and will avoid those bigger injuries and illnesses and incidents. Also, make sure you're communicating with the employees. Make sure the employees report the injuries immediately. They need to know that that is company policy. You're going to interpret any corporate policies for that employee so they understand what the process is, what they need to do. Monitor the employee's health and function. This is going to be an ongoing job. It's not just a one and done. We need to constantly be getting updates. checking in on them, checking with their supervisors, checking with their doctors. So make sure you're using your communication skills. Because this is medical, it is HIPAA protected, so you have to keep it confidential. You don't want to be giving too much information out to other people that don't need that information. Remember to practice active listening with the employee so you understand where they're coming from, and then be supportive, show care, show concern, be supportive to them when you're communicating with the employees. As far as the medical care, the doctors need to know what is their job? What does this person do? What is their job description? What are the requirements? What are the physical requirements of this job? What are the typical tasks that they do? Where do they work? Do they work indoors? Do they work outdoors? Do they work at night? Right? What are their conditions? The doctors need to know possible transitional work assignments. So if you already have some of those job suggestions there, that doctor can agree with you. Yes, this would work. This would be a good job for them until they're recovered. Or they could do this until they're to this point, and then you can switch them over to this. Your willingness to comply with doctor's restrictions and to support the employee during recovery. You don't want them doing anything that the doctor isn't approving. And then you want to make sure that the doctor has all of your contact information. That way, they don't have any excuse not to get back to you or not get you the information that you need. So, some of the things you want to ask the doctor, can they return to work? Well, a lot of that's going to depend on their restrictions. When can they return to work? If they can, what restrictions will they have? And what can I do as the facilitator to best accommodate the employee during recovery? So that doctor is going to give you all the information you need to make sure that this light duty job fits the restrictions, and we're going to minimize the amount of time that this person has to spend in their restricted role. With the employee, we want to make sure that they understand what the doctor is telling them. Hey, so and so, you can't do your normal job because the doctor says no, you can't lift this much poundage, you can't reach above your shoulders, you can't sit down for this many hours. Whatever it is, you want to make sure the employee understands it so they can stay within those restrictions. We want to let them know what their return to work options are. Maybe we have several jobs that they could choose from, and we let them pick the one that they most would like. We also want to make sure we're telling them, okay, you need to go back on this date and meet with a doctor for your follow-up visit so they can evaluate you and see how you're recovering. Let them know what the permitted employee activities are during recovery, including time away from work, right? If this is a very active person or they like to do outdoor stuff or sports or, mountain biking or riding quads or whatever it is, maybe some of those activities need to take a break as well because the restrictions are not just for work. These restrictions are for their body in general. Um, you want to make sure you are the contact person for the employee's medical questions. So if they have questions, you want to make sure that the employee knows who their contact person is. And then you want to supervise the employee communication plan, right? How often are we checking in? Who's talking to who? How often are we going to follow up? Who's letting people know about updates that come in? And then, like I said, you want to have a relationship with the medical provider. You don't want it to just be the random place wherever's closest to where this injury happened. You want to have designated facilities. I always recommend some type of industrial medicine facility where you can develop a rapport with them. They're going to be much more employer friendly. They're also going to understand light duty and things like that much clearer. So think about how you have typically handled communication with medical providers in the past. Has there been any communication? Do you struggle with it? Right? So having that relationship will ease that. How do you choose your medical providers? Like I said, most places just go, yeah, go to the nearest urgent care, and that's it. And then who is responsible for communicating with the medical provider and their office? Is it always the same person? Is it somebody different? So you want to make sure that that's why you have that relationship. So you can develop the rapport, you can develop the expectations, and you can develop that communication with the medical provider. The return to work status. So following an injury and medical care, so after an employee has been taken care of, We want to make sure that the doctor is the only one that can return them to full work duty with no or few restrictions. So that is up to the doctor's discretion, not even the individual, right? Only the doctor can clear somebody back to full duty or let us know what their restrictions are going to be. Okay. Sometimes the employee has to stay home for a period of time. It really just depends on the severity of the injury and the type of injury and what the medical treatment's going to be. But we want to have a transitional work assignment waiting for them as soon as they are cleared for that light duty or restricted duty. Got to have a communication plan, right? We got to keep in touch. So demonstrate your concern and desire to see the employee back at work. Create a communication plan together to stay updated on their progress. Maybe you say, hey, we're going to check in twice a week. I'm going to check in with you on Wednesdays and Fridays. Or maybe we check in just on Fridays. So decide how often you will call so that expectation is there. That way they know that the call is coming. They don't avoid the call. They can't say that they didn't know about it. Think about you personally, what kind of manner or attitude you will have, right? Remember to be active listening, be supportive, caring, try to understand where they're coming from, right? What are you going to talk about on that phone call? How are you feeling? How's your movement? How did the last doctor's visit go? Right? Did the doctor say anything? How has the new light duty job been? Who else are you talking to? Maybe you're talking to their spouse. Maybe you're talking to their kid. Maybe you're talking to, um, individuals, union reps in some cases. So make sure you have a communication plan and that you're thinking about these items. And then when we transition employees back to work, right, we want to let coworkers know, hey, so and so is coming back to work, or so and so is going to be doing their light duty job. This is what they're going to be doing. This is the transitional work, right? You want to have a first day back and the return to work meeting. And then ongoing, we want to check in with them. We don't want to just set them loose and we don't hear from them again. We want to check in. Hey, how's this job working out for you? Are you feeling any pain? Do you think it's going to work until you're recovered? Right. So meet regularly to discuss the recovery and any modifications you may need to make to that work to fit the restrictions that they have. All right, in the return to work meeting, you want to talk about your doctor's restrictions and your support for the doctor's recommendations. You're going to talk about the new job duties and the accommodations you're going to make with those job duties within the restrictions. We're going to talk about any changes that have happened at work, things that they should be aware of. We want to address any concerns that the employee may have with this return to work plan. We also want to communicate the plan for recovery information. So this is how often we're going to go to physical therapy. The doctor is predicting this many weeks. This is how often we're going to check in. And then make sure all the company paperwork is taken care of. We've documented everything correctly. We've sent out the notification to the proper places that we need to, and make sure everybody's aware of the information. Then planning your accommodation, right? So there's different types of accommodation. There's formal and then there's informal. So the formal accommodations may be what you're written out in that job description. Informal may be, hey, work to tolerance. So if you're doing something and it hurts, take a break. Go sit down for a sec. Do a different job, right? So we can make more accommodations kind of as we go, but we want to have it written out what their formal accommodation is. So by planning the accommodation, right, we want to have a good description of what that light duty looks like, right? Maybe they can only be back for not a full shift. Maybe they can only be back for 4 hours at a time, then 5, then 6, then 8. So it may be only part time, but at least we're trying to get them back to work and we're not forgetting about them. We're letting them know how their existing job duties will change, or are they going to have totally new job duties? So we want to explain to them with detail what their job is, what the expectations of that job are as well. So with transitional work assignments, why would we need transitional work? So This provides a normal routine and a productive, meaningful activity for the employee during the healing process, right? So if I can't do my normal job, what is my transitional work assignment? What job am I going to be doing in the meantime, right? So at least gives me, I know what to expect, I know what I'm doing, and I feel like I'm contributing to the company while I'm on the mend. It also gets the benefit of the employee's contribution, right, during the healing process. So the employee feels like they're contributing. The company is getting some contribution from the employee. They're getting some kind of benefit out of it as well. And then it allows the employee to return gradually to wellness and normal work rather than go abruptly from complete unemployment to full unemployment. So it would be I stay at home until the doctor says I can go back to work, and then I go straight back to my old job. So it kind of helps them ease into back to their full-time job. So it's a much gentler transition. Also, having that transitional work assignment, the employee tends to recover faster, right? The more active you can be, the more recovery your body will have, the quicker people tend to heal, and we tend to have better outcomes, right? No long-term disabilities, more full recoveries, faster recoveries. With the coworkers, they see how the company has taken care of that individual. It demonstrates the company policy. So they see the light duty plan in action and they build trust. They're like, "Oh, they do what they do. They follow up. They take care of this person." That makes me feel better that if anything ever happened to me, they would take care of me the same way. And then with the company, it's a benefit because it reduces costs and we have them there helping. So it increases productivity. This person isn't a total loss as far as production goes. So with general problem solving, remember, this is our job. As the facilitators, our job is to be the problem solvers. So what is the problem? We're going to talk about possible solutions, and you may have to get some input, right? Maybe from the individual, maybe from the doctor, maybe from the insurance carrier. Then implement the best solution. Once you've decided what that solution is going to be, you want to make sure it's fully implemented. And then get feedback, collaborate with the employees throughout the whole process. So make sure hey, is this working? What's not working? What can we do better? What would you prefer? Excuse me. All right. Also with problem solving, what are the common risk factors, right? So solving problems on the job site, right? What if we start to see a pattern? What is that pattern we're seeing? What are the risk factors? What are the common injury sites and locations? What are the common causes of injuries? And what types of injury are the most common? By doing that, it can help us focus on where our emphasis needs to be as far as training, um, engineering controls, administrative controls, PPE, and accountability for people maybe that aren't following the rules that could result in an injury or incident. So our best idea is to analyze the workplace. Like I said, do a checklist, do a job walkthrough, do a pre-task plan. Find out what your workers' behaviors and attitudes are, right? Are the people happy? Do they look sad? Do they look dejected? Do they look worn out? So what's their posture like, right? Are they hunched over? Are they practicing bad ergonomics? That's going to create problems. What is their body movement like? How long are they working at a workstation, right? What kind of feelings and attitudes do they have about it, right? And then the work environment, make sure we're emphasizing health and safety. We can build that into the work environment in many cases. Make sure the company attitudes and policies are well known throughout the work environment, that everybody's aware of them. We want to do training on a regular basis. We want to communicate the expectations and give the employees the knowledge they need. Once we've given the employees that knowledge, then we can enforce our policies. Can't enforce something that people aren't aware of. So we want to make sure that everybody knows so that everybody's on the same page. Nobody can claim ignorance or not knowing about something. So then we can hold people accountable. Keep in mind, ergonomics is the science of fitting the work to the body. We don't want to just have this one size fits all solution. People are different heights, people have different builds, People have different requirements or needs. So whenever possible, we want to fit the work to the person, right? If they have to bend over less, can we raise their work to where they are? Can we bring the work closer to them? All of these things are going to keep their body from wearing out and developing musculoskeletal disorders. So by concentrating on ergonomics, we're going to reduce the risk of injury. Okay. It enhances safety, makes the job more comfortable. Because of that, we're going to be more productive because we're not getting so worn out. And because we're more productive, everything's going to be more efficient. And by focusing on ergonomics, we're going to prevent those musculoskeletal disorders, and it can help us mitigate anybody who has any existing musculoskeletal disorders. Once we've decided on our solution, we want to implement it, right? Number one, communicate what the solution is. We want to make sure everybody knows what's coming, they know what to expect. Then we want to gain the employee support, right? We do that by communicating with them, getting their feedback, making sure that they have a chance to ask questions. We listen to their input. We're going to monitor and evaluate the solution, right? It may need to change as we go along. With that input from employees, we can make things better. So it's important that everybody is practicing good communication so we can develop this program as fully as possible. When you do your accident investigation, make sure you have witness questionnaire forms. You want a third party to not just the individual and not just the supervisor, but was there somebody that saw this happen? Okay. That's going to give you kind of a more perspective on it. The supervisor should be the one filling out the accident report. They know the work, they know the work environment, and they're the ones that are responsible for the safety of those working underneath them. You should inspect the site. You should go and see where this incident happened and see if there is anything in the site that contributed to this accident or this injury. Within your accident injury report, the whole reason that we do this, besides just documentation, is what we call root cause analysis. What are all the contributing factors that follow this? Is it just because, Jimmy is dumb and he just made a bad choice? Well, it's usually a lot deeper than that, right? Is he dumb because you haven't trained him, that you haven't told him that he's never been showed how to wear his PPE? Is it because, yeah, he knows, but nobody makes him do it? There's no accountability. So there's not just usually one reason. There's usually several reasons that contribute to an accident or an injury. Okay. And then we want a takeaway. When an accident or an injury or an incident happens, we want that little nugget of wisdom that we're going to take away with so we can prevent this from happening again. That should be the focus of your accident investigation. I would ask the employee, hey, what would you do differently this time, or next time? What would you do differently to keep from getting hurt? What could you have done differently? That's really the important thing is it's not a loss if we can gain some kind of knowledge from it to prevent reoccurrence. All right. So where can you go for resources on all these things? Well, OSHA, the OSHA website, OSHA.gov, is really good. It's come a long way. So they have information on ergonomics. They have what are called e-tools that kind of help you search for risks and hazards within your job site. And then they also have industry-specific and task-specific guidelines, mandatory trainings, what those trainings should look like, things to look out for in certain industries. The BLS, the Bureau of Labor Statistics, supplies injury-specific data on common causes of injuries and illnesses. So if you haven't had a lot of injuries or illnesses, but you want to know what the typical ones are in your industry to look out for, that's a good source. And then your insurance provider. The insurance carriers can provide a variety of other training materials and tools to help you guys learn more. You can also reach out to us. My whole job as a safety and risk advisor is to give you advice on safety and risk. So I can help you do those job hazard analysis. I can help you do your accident investigation. We have a template for a light duty return to work form. So please don't hesitate to reach out. We're here to be a resource and we're here to help you. Okay, I have a question on the Q&A here. So, one of the questions was, in Arizona, is it advisable or illegal to pay an injured employee her lost salary if she is not able to be at work, just to keep the medical costs from being part of a work comp claim and losing that 70% discount? So, um, what he's asking about is when you have an injury and it is for medical only, so meaning only the costs that were paid out were just the medical bills. You got them returned to work. You did not pay out indemnity. This is wages for them to stay at home. When they calculate its impact on your EMOD rating, you get a 70% discount off that. As soon as $1 is paid out in indemnity, you lose that discount. So, Phil, I'm not a lawyer, so I'm not going to give you legal advice. But what I've seen in the past is they pay the wages of the individual. You want the return to work because you want them to feel like they're contributing, but by paying those wages, the insurance doesn't pay out the indemnity. What I will tell you too is that in Arizona, the indemnity automatically begins to be paid out after 7 days. So once they've been off of their normal job for 7 days or more, that's when the indemnity will automatically start being paid. So that's why it's very important that we're on top of this process and that we get the return to work involved as quickly as possible, and hopefully get them back to work within those 7 days. Otherwise, it will automatically go out. So I don't think it's illegal to pay them their wages. I've never heard that it's illegal. I wouldn't advise that you do that. I would search um, for something for them to do, right? Just for all the reasons that we talked about here, all the benefits that come along with that. Feeling like they're contributing, you get some kind of productivity out of the individual. But if you're paying their wages, then the insurance isn't paying their indemnity, and that's what you would let the carrier know. Hey, we are paying them their normal wages, and we have a light duty return to work program. So, good question. I had another question where somebody asked where you can get paperwork examples and templates. That's what we're here for. So just reach out to us, safety@lebaroncarroll.com. That is our safety email. You can reach out. Like I said, we have a template. We just newly updated it, a template for light duty return to work. And then we also have our accident injury report and all those kinds of things as well. So I hope this was a helpful presentation, and hopefully we'll see you all at the next one. All right. Take care, everybody. Bye.